My name is Andrew Hadfield-Ames, and I'm going to be chairing the session today on behalf of Can Digital. But until recently, I've been working for a number of county councils, and I'm also the vice chair of LG Comms. So, on to today's session. Really pleased to be talking about this incredibly topical subject, with the Chancellor of the Exchequer announcing an extra £1 billion worth of funding to this broad area last week at her spring statement. First up, we've got Catherine Jevons, or CJ, who's the Senior Communications Officer at Surrey County Council and whose team produced the WorkWise campaign. Over to you, CJ.
Lovely. Okay, so I'll just give you a bit of an overview of the WorkWise campaign. So just a bit of an overview of what WorkWise is. So WorkWise is a Department of Work and Pensions funded free employment service available to any person with mental or physical health conditions, disability or neurodivergence. And this was people that want to work or people that were currently in work and wanted to sustain a meaningful and long-term paid employment. It was launched in Surrey in July 2024. The insights behind WorkWise, or the reasoning behind DWP funding this initiative, is that we know that being in work provides many benefits for employees, employers, and obviously our wider society. For employees, this includes improved mental and physical health and increased financial stability and independence, but also on a wider basis, it's a prevention mechanism for future demand on our care system. So we had several delivery partners within Surrey. We had Surrey Choices, Richmond Fellowship, who are now called Way Through, and Get Set UK. They were our main referral agencies. And then we also worked with Surrey Welfare Rights and Citizens Advice. Once those applicants were accepted onto the programme, individuals received a range of employment support, and this includes things like writing a CV, identifying skills to match to a role, interview training, and benefits advice. So, as I say, there were three main referral agencies that were supporting individuals. That was Surrey Choices, Way Through, and Get Set. But also, in tandem with this, Citizens Advice were able to signpost and refer people into the programme. So we know that in Surrey, Citizens Advice is a really important partner for us. Additionally, the Surrey Welfare Rights Unit, they received referrals from the three WorkWise partners and Citizens Advice, and they were able to offer people bespoke advice service on things like housing, benefits, etc. So from a comms perspective, what were our communications objectives? So increase awareness of WorkWise scheme with residents and businesses in Surrey, and obviously to encourage sign-ups via employers and referees to the scheme. So Surrey, considered to be an affluent county, but like other people, we obviously have our pockets of unemployment and economic hardship. And in particular, there were two boroughs that had a lower disability employment rate than the national average. So that allowed us to geo-target some of our comms activity on those areas. We do know that the unemployment and economic hardship was worsened by the pandemic, and in particular, it did affect this target audience, so those people with long-term disabilities or health conditions. We also knew or had some insights regarding barriers to employment for these people for people with disabilities. So those were personal barriers, institutional barriers, and structural barriers. So those are issues related to access at work, stigma, difficulty with transportation, and inflexibility, and their personal barriers were lack of confidence and anxiety. So things that needed to be considered when developing our communications plan. Obviously, we needed to think about how information is processed by this target audience. It needed to be simple in language and messaging, and it needed to be accessible. So it was free from jargon and easy to understand. And we obviously used things that I think a lot more people since COVID are aware of, these alternative formats such as Easy Read. We also had an online explainer video, and this very much used the similar sort of imagery that is used within those sort of easy read publications. The imagery is important in terms of making sure that people don't feel alienated by the campaign, and it took the form of people like you. The campaign, I will stress, was very simple and very straightforward. I have to say, probably with hindsight, from a purist point of view, for me, I would have liked to have spent a bit more time and budget on really getting to understand how this target audience search out and like to receive information. As it was, we needed to get it out fast, so simple was best. This campaign is not going to win any awards. It's not going to have any candor or any of that sort of stuff, but it was simple. There was no, at that time, DWP comms toolkit provided, which sometimes is provided with these sort of campaigns or initiatives. However, I think I would honestly say that the Can Digital part of the campaign allowed us to tweak a messaging and look at what was working and what wasn't working. And so that was the bit that was very flexible and probably got us the most results. So, as I say, there were several different target audiences. You've got end users, you've got referrers, and you've also got businesses in Surrey. So it was very much a integrated campaign. So it was a mixed media campaign. And the sort of things we used, in addition to the Can Digital campaign, were organic social media, Nextdoor, which obviously allows you to do geo-targeting in specific areas. So that's where we focused some of it with regard to those two boroughs with the high disability unemployment rates. Printed flyers, good old printed flyers, we used at stakeholder engagement events. And in particular with the end user, we also very much had in mind that not only was this information going to be received by end users, the person that was going to receive the service, but probably it was good to assume that actually there would probably be other members, such as family members and carers, that probably act on behalf of the end user as well. So it needed to have a general appeal. As I mentioned, the online explaining video was up front on our website. It had subtitles and BSL and used imagery very much similar to what we would see in easy read publications. The referring organisations also did their own marketing. They did webinars and seminars with existing networks such as the VCSE networks and key NHS partners. We provided them with flyers. We also provided them with pop-up banners that they could use at events to attract people's attention. And we very much at Surrey are used to producing comms toolkits, which usually do suggested social media lines, some imagery and editorial that can be used to send out to stakeholders and to put in a sort of ready-made editorial for newsletters. With the employers and businesses, we looked at LinkedIn, and they were also targeted via presentations and webinars. And we also used local business newsletters. So obviously district and borough councils have business newsletters that they send out to their business rates customers. So we provided editorial for them and obviously our local Chamber of Commerce. As I say, the campaign creative was very simple. We had to go with the name Workwise. So we were stuck with that as a campaign name. I'm not sure that it says what it does on the tin for me, but that's what we had to work with. As I mentioned, we had several delivery partners, but the decision was very much taken to keep it very simply branded. So we went very much with the Surrey County Council logo as a method of communicating and seen as a trusted partner. And then once you got to the website, we were very upfront about who our delivery partners were, because we were thinking about the user journey and making sure that when people then contacted as a result of applying, they knew from the start who these people were. So it's no surprise, who are GetSet, which was kind of my question right at the beginning when I first met GetSet. It's like, sorry, who are you? So yeah, as I say, very simple campaign, and there's the easy read version as well. Those are some of the numbers. I'm not going to go into those now. And then I'll hand over to Can Digital and they can talk through what the digital campaign did in terms of driving results. Thank you. Over to you, Matthew.
Thanks, Matt. Sorry, thanks, CJ. That's really great in terms of those insights. And I look forward to hearing from Matt around our next speaker just while he's uploading his slides. So over to you, Matt, who is the campaign specialist at Can.
Thank you, Andrew. Thank you, CJ. We always use Workwise as the sort of pinnacle of how to plan and execute a campaign. It's wonderful to work with a team that literally ticks all the boxes and provides as much insight to make our job a lot easier. At Can, we always focus on 3 communication principles, one being inclusive, reach as many of the target audience as possible, always looking for ways to save money and to get media for free, and also are comms really anything without data? And for this campaign, we were able to reach over 90% of the target audience. The heavy lifting was done by digital, with the physical and human interactions supporting alongside that. We focused on saving by using some of the media estate, the council-owned media estate, so the out-of-home emails and website there, and always focusing on that pound spent equals pound saved. And then who's the target audience going to be, where and what channels are they going to be using, and what impact that's actually going to have. So here's a little screenshot of Surrey's population by age and some of the channels those different age groups will be using. We estimated that the target audience for long-term conditions in Surrey was around about 170,000, with the unemployed audience being about 34,000. And then we started gathering all the insight. So we got all the data that CJ covered off from all the different voluntary organisations. We used some of the Orlo social media listening search insight, and also then looking at paid search, so on Google and Bing, what people in Surrey are actually searching for associated to the campaign. We looked at all the information on the landing pages, had a deep dive into the audiences, looked at a lot of the previous campaigns that were quite similar, that would run either in Surrey or further afield. And then that kind of helped us influence the sort of creative and messaging that was going to be running. We then took a bit of a deep dive into the various social media channels, the audience building platforms and AI tools that we use for campaigns, to kind of see which are going to be most relevant for the audiences that we're going to go after. That helped us sort of ignore some of the channels that didn't kind of reach the targeting capabilities or the sort of size of the audience and the location that we needed to go after, and they had quite high sort of cost per clicks on there. It also got to get rid of some of the bigger awareness channels because the targeting is always quite low on there. The measurability is little to none. It's quite highly wasteful, and the cost per outcome is always high, so it would have basically given us fewer outcomes per budget. Then that gave us a sort of amplification mix. So it was like I said, the council-owned channel, so the out-of-home web and newsletter, and then alongside a few various Google platforms with Meta and Snapchat alongside there too. Plugged all of that together into an easy, manageable plan to send over to the team with the basic strategies that we're going to be covering off. And that gave us the sort of awareness channels that we'll be running, so the council-owned channels, as well as sort of Google awareness and the social media platforms. Then a bit further down that consideration will be people searching on Google and Bing for any keywords and phrases associated with the WorkWise campaign, and then the remarketing side of things for people that have visited the website. So if you ever look at a pair of shoes online before and they follow you around the internet for the rest of your life, it's that horrible technology, but used in a good way. And then we started having a look at the user experience, and we focus quite heavily on there because it can make a massive difference to your sort of conversion percentage of users that have gone through to the landing page. And it was very text heavy, I think you remember, CJ. So that we basically quite quickly turned around a really basic inclusive landing page with the wonderful WorkWise video in there and a really easy to use inquiry form at the bottom. And what we're then able to do is get all of that data back. So provide CSV files for all the inquiry data, break that down by day, break all the different platform data back, broken down by day, plug it all into a Looker Studio, and then we start to correlate campaign activity against campaign submissions, and we can sort of cut out bits of the campaign that wasn't performing well and move that money into sort of strategies that were delivering more outcomes. And then what that gave was the CJ and the team visibility over everything that was running, and you can start to see the optimizations that come into play. So with the blue line being interactions, the orange line being submissions, as it starts, the sort of cost per outcome sitting at a base level, but over time, as the optimizations are implemented, that blue line starts to decrease. So overall, the cost per outcomes start to work its way down, which is what we're here to try and do at the end of the day. And so, yeah, some of the optimizations that the team work behind the scenes, so performance-based, so based on the different platforms and how they're converting into a sort of cost per outcome. It could be certain creatives are performing well to certain audiences compared to others, so they'll get upweighted. It could be by geolocation. There's a bit of human pruning going in alongside a bit of the supercomputer machine learning, and overall that will reduce the cost per outcomes, providing CJ and the team with more outcomes per pound spent, meaning we can slowly move away from stuff that doesn't work into stuff that does. And the valuation being, at the end of the day, we're able to report back with the team on pounds spent equals pounds saved, which is what everyone wants to see at the end of the day. So yeah, going back to those three principles, making sure you're reaching as many of your target audience as possible, always looking for ways to save and report back on pounds spent equals pounds saved, and ensuring that you got full transparency over the data for all the platforms that you're using, and looking at all the campaigns that you're planning in the future. If you're not confident you're going to be able to hit any of those 3 metrics, feel free to drop me a little line and we can have a chat.
Thanks, Nick. Thanks, Matt. Sorry. Yeah, really comprehensive, and yeah, I can see that the questions and comments are already coming through. So please do keep those coming. Last but not least, we've got Nicholas Warren, Managing Director at Dragongate, who's going to build on these great presentations with his own take on the work in Surrey, but also give it a little bit of a wider UK context and using their research and market intelligence. So over to you, Nick.
So thank you very much for the introduction. And yes, I am Managing Director of Dragongate, but today I will be wearing my hat of Breaking Barriers Innovations because that's our link to the work of CAN and Surrey. So just a really quick explanation. All of our work at Breaking Barriers is around place, because most people in both the public sector and outside the public sector seem to agree that a place-based approach is much better than working in silos. It gets us to make smarter use of resources. But place doesn't have a budget, organisations do, and people sit behind those organisations. So our work in Breaking Barriers Innovations is really to take really successful examples of where place-based partnerships have made a difference, but particularly where we've actually engaged the user experience to actually design and improve services. So the work we've been doing in Surrey and the work which CAN have been doing alongside Surrey are actually really successful examples in our minds of what can be achieved. I'll take us back a bit in terms of a strategic picture, and then I'll bring us back to Surrey later on. But our work, just as a snapshot, our work before lockdown was very varied. Lots of different things between working with local government, NHS, industry, and different strategies. So it wasn't just around employment. And then we had lockdown, and something quite interesting happened, particularly from the NHS. A lot of the direction in terms of what they're really concerned with, apart from the obvious concerns of the pandemic, was around employment and the effects lockdown would actually have on health rates, particularly in areas of high deprivation in the decades to come. And simplistically, you're 5 times more likely to be in poor health if you're unemployed than if you've got a job. And that doesn't even take into account being in a good, stress-free work environment. Any job at all is likely to improve your health. So in terms of the social determinants of why you would end up in hospital in the first place, having a job from an NHS perspective is one of the best interventions they can really drive through. So the whole mission around economic inactivity at the moment, which is driving the DWP programs, there's an opportunity here to partner with far more organisations than the sort of the usual suspects. So there's a lot happening around that. From a system and health perspective, they can't rely on top-down approaches. So I think the advantage of the funding coming from DWP at the moment is that there is flexibility for local areas to tailor it to what they want. And the reason for that is we look at the history of top-down interventions over the past couple of decades. If we look at apprenticeships, those very well considered ideals about getting people into the employment bracket through alternatives to university, they're missing the mark at the moment. Actually, the least deprived are almost half as likely to be taking up apprenticeships when they were set up, and those people who are least deprived are more likely to be basically taking them up. So there's some sort of misalignment there, which again goes back to why the user experience is so critical. Another reason that it goes way beyond just the employers is that we can't afford not to invest in skills and training pathways for people going into employment. If you just take social care as an example, unless we've got people equipped to work in a digital social care tech model, and we've got people with confidence and the providers are working with digital, then the cost of running just becomes more and more expensive. If we just focused on traditional methods of delivering services, we can't basically afford it. So there's another very, very strong reason that local authorities around the country need to invest in different pathways, bringing people into employment, skills and training. And then the final sort of factor which is driving this, and again, this is related to lockdown, but it's also related to what's happened since lockdown. When you start looking at economic inactivity, we're very, very aware as a country, we've got an increasing ageing population, and that ageing population is accelerating in rural and coastal areas because in places like London, in 30 years' time, it's likely to be the same. So it will accelerate outside of the big cities. So that's a challenge. But if we then look what's happening further upstream in terms of the generational pyramid, all of these age groups have got significant areas of concern when it comes to economic inactivity, but particularly around the younger cohorts, which is driving the largest rise in economic inactivity at the moment. So we need to think much younger, and therefore we need to think about different methods, such as the stuff which CAN does and is doing with Surrey at the moment, as key advantages. In terms of the work we'll be doing around the country, I think a really, really important part of that is in terms of designing plans, don't treat the community as a consultation organisation, use it to actually drive the co-production of this. So when Clacton, which is doing a lot of work around this at the moment, they decided to actually throw everything they could at economic inactivity. They actually got people with neurodiversity, people furthest away to the employment market, and they paid them to be the researchers of the project and asked them, how can we get you into good sustainable employment? Everything is on the table. And so when they actually put together the Clacton Place approach, they were thinking far broader than NHS jobs. They were to bring in so many different examples of opportunities for the cohort. So just one example around that, when they designed the Community Diagnostic Centre, they worked with the voluntary sector, they worked with the cohorts, they worked with the DWP, the colleges. So as many jobs as possible for those non-clinical roles essentially went to local unemployed people. So it just shows, the examples of we plan early enough around this, the sort of differences it could make in areas of high deprivation. So Surrey is part of the More and Different programme. It's got two aspects to it. It's about more and different roles, because we've got to think outside of traditional roles, and it's thinking about people from more and different diverse backgrounds. We're working across 12 locations now, but we started off with initial 8, with Surrey being one of the principal ones amongst that. All of them have got a different area of focus. So Surrey at the moment is focused in the More Different programme around 50 to 54-year-olds and in-work poverty, but there's cross-learning from all the locations. And in terms of some of the insights so far, there's 6 really critical intervention points, which is coming up in every single project, whoever we speak to, which in terms of that employment pathway, to make it more accessible to more people, we need to get right. And it's not the question of, we'll just focus on one of these and that will give us the biggest bang for a buck. If you're doing great work on engagement, but then you've got a rubbish pre-application process and it's really complicated, all of the value you've done in the awareness will not work. If you've got great jobs, but they're not very good career pathways beyond that, then you'll have retention issues. So it's about actually thinking all the different things which a system and employers can do around that. In terms of Surrey, More and Different isn't just going to be limited to this, but this is the priority groups which they began working with us on, which is running in parallel to the WorkWise programme. So 50 to 54-year-olds, because in terms of place, that's the biggest economically inactive and actually biggest economically active group across Surrey because of the way the age pyramid work. And there's a particular issue across the country, but also particularly in Surrey because of the cost of living crisis, about people trapped in in-work poverty. And actually, if we don't actually give them that next step, they'll have mental, physical, economic issues in due course. Couple of last slides on this. In each project, it's driven by the employers. We spend most of our time actually working with the employers because it's to make it sustainable, they've got to be driving this. So we've got 10 anchor employers working on the Surrey project, all committed to opening up jobs, roles, changing the recruitment process based upon the evidence as it comes through. And we've got basically we're into a sort of a phase 2 delivery plan where each of the employers are really using the program to rewire the way they do recruitment and retention at the moment. They're working as a community practice, so they're sort of egging each other on with more and more ideas and incentives, so they feel that they're owning it. So eventually, the system and national government can catalyse things, but that's unaffordable in the long run. It has to be translated into business as usual as the employers. And just to come full circle with the original presentations, which I thought were excellent, by the way, in terms of those 6 critical intervention points, CAN are working with a couple of the more different programs at the moment, but particularly around that awareness pre-application, application phase, basically how we can actually use digital to get more and more prioritized engagement from the cohorts and locations are doing. So we're very, very excited about working with CAN, about making sure whatever we do with them, it actually resonates with those groups. These are generic slides, which I've just taken from one of their slides. So when it looks with the 50 to 54-year-olds, we'll be looking at very, very different channels. But also it's something to give the employers very, very early on that early dedicated site, which I think is really, really quite crucial if they're going to be involved in it. This is all building up into big stuff. So we've got a national representation in more and different from the joint DWP DHSE work team at the moment. So there's lots of opportunities coming. But I think the issue is if we don't actually tailor them rightly with each location, the danger is actually we're not actually fixing the problem. We're just creating more programs, more confusion on the ground for people about what they should be doing. So it's really, really important the work which Surrey and CAN are doing together. And final slide, I've probably gone over my time, apologies. But in terms of the outcomes for all this and the work we're doing with Surrey and CAN, alongside all the other locations, the 5 things which are absolute key are we've got to improve the access and representation of the cohorts in each location. Over time, over a multi-year time frame, we've got to see more retention rates because that's going to incentivize the employers to be doing more. It's got to be scalable. It can't just rely on statutory funds. It can be catalyzed, but the employers need to actually be delivering it. More time is spent on delivering, not designing stuff, and we're continuing assessing and identifying threats to actually basically more inclusive recruitment practice. I shall stop sharing there. I hope that was okay.
Brilliant. Thank you so much to Nick, but also before then, CJ and Matt. I think we've covered a lot of ground in 32 minutes. So I'll give people a couple of minutes to sort of digest some of those points because there's a lot to take on. But CJ, hopefully you've picked up from the chat. I think there's a question primarily aimed in your direction, but if you're all right, just to summarize it, I think the question is that did you have a creative license to create your own campaign look and feel, and did this have to be approved by the Department for Work and Pensions? Thanks.
Okay, so there was no look and feel, and we very much went with a Surrey County Council template. It was very simple, stock shot, headline, and body copy. And no, I didn't get it approved by DWP.
Thanks, CJ. And Maria, I'll come back to you in a moment just to check whether that's answered your question. But CJ, I think you put also in your slides that there wasn't any kind of toolkit or anything from DWP, and just thinking about what I think Nick covered off towards the end there around having that kind of 6 key things to cover off, but still having a localized approach. I guess the question back to you is would it have been helpful to have some of those kind of branding or toolkits available to you to then be able to localize for Surrey and knowing your local audience?
Yeah, I mean, I think we learned during COVID that any of those localized campaigns obviously did a lot better. And I think, that's very much our approach during COVID, is that we developed our own campaign look and feel, and then localized it with our 11 district and boroughs, and that definitely worked for us. But in this case, I made it very Surrey County Council branded, and that was the level of it. Yeah.
Brilliant. Thanks, CJ. Grace, I have seen your hand up, but Maria, can I just check that has covered off what you were looking for, and whether you had any kind of further comments or wanted to follow up that line of questioning?
Yeah, thanks. Thanks, CJ. I should probably put my camera on.
Don't be shy.
Thanks for the presentation. Okay, thanks for the presentation. That was really interesting. So it sounds like obviously there was a quick turnaround to sort of deliver and get this out the door, and we know what that can be like in comms and marketing. I don't know if this is the question to ask, but did you have time to sort of test any of the creative before it went out? I'm just thinking about the nuanced audiences and whether there was an opportunity to test and make sure it resonated with audiences, or would that be something that could be considered for sort of, I guess, future campaigns and iterations? We're quite big on testing a lot of our creative before it's sort of rolled out. Yeah, just wondering if there was scope and opportunity to do that.
There wasn't. I'll be honest with you, I'd been on secondment for a year, and I came back and had this landed on my desk, and it was a bit like, right, I needed to hit the ground running. But as I think I put in one of the slides, with hindsight, budget and time, definitely we work very closely with some of our disability networks across Surrey, and I would have definitely liked to have tested some routes. I mean, I'm from a advertising agency background historically, and we always used to test 3 creative routes with focus groups, but I know that we don't always have the time or budget, or to have that luxury. But absolutely, yes, wherever possible. I think there's a lot of assumptions made about certain audiences, and I think you're right. I wanted to really get under the skin of what would resonate with these people, but yeah, I just went simple.
Yeah, no, that's really helpful, because thinking about potential future campaigns and making sure we allocate that time for testing,
Yeah.
especially with audiences, color contrast, things like that, making sure it's accessible, like you mentioned, easy read formats, and those things take time. And if there's time to test, it's worth me just kind of feeding that back to kind of stakeholders, that we should really factor that in terms of campaign planning. So yeah, no, thank you. I found it really, really, really interesting. So thank you very much.
I would say I think that the online explainer video was a bit of was a definite asset. And as I say, they very much use the sort of type of imagery that is seen in those easy read publications. So I think that was probably a good learning. Thank you.
Thank you very much. Cheers.
Brilliant. Thank you, CJ, and thanks for that question, Maria. Grace, I'm just going to keep you holding on the line just for a moment, just because I want to just see if Matt or Nick have got any sort of contributions within this. I think specifically, Matt, I was going to put you on the line in terms of some of the work that I know you've done in other campaigns, if not for this specific one, around some of the A/B testing that you can do for adverts, but also, as you showed that graph, in terms of reducing the sort of the effectiveness or the cost per click. So I just wondered if you wanted to come in on that. And then Nick, I think you brought up that brilliant example around Clacton, around that co-design process. So I don't know if that was something that you would like to bring in this point. And I think just a general observation back to Maria's point, there's a phrase that I can never quite get right, but I think sometimes in comms we try and sort of let perfection get in the way of good, and it very much sounds like, CJ, you cracked on, got some real results, and actually sometimes you've got to go out with less than sort of perfection, but otherwise you won't get anything done. But Matt and Nick, did you want to come in on either of those points?
Yeah, I think the power of digital, you can almost do the testing of the creatives in real time. You could plug in 100 different variations of a creative. I think Maria said you kind of make assumptions about who's going to interact with what. But if you can send out a whole array of different creatives at the same time, in a matter of hours, you can start to see which cohorts are interacting with which creatives the best, and then remove the underperforming ones, and then focus on either replicating or increasing the number of the style of creatives that are performing really well. And even these sorts of groups sharing ideas, sharing creatives. One creative that might work for this in one location probably will work in another location, with just removing the logo and sticking the new local authority logo in there. So it's, if you've got creatives that are working well, we always try and share it with the wider local communities, and trying to see, is it replicable in Surrey? Then it might work in Hertfordshire, it might work in Devon, it might work in Dorset. So it's sharing as much as possible and constantly just testing creatives, I'd say.
I think JP did come back to us with the creative that had performed the best. Yeah, so we did get a bit, and luckily it was one of the images we'd used on our printed material. So I'll go with yes, intuition. Yes.
That's great, but it's great to rely on some of that intuition. I think one of the recent LG Comms case studies, actually, for Westminster City Council, actually some of their creatives actually went against their natural intuition, and some of what they thought were either the slightly more boring creatives actually were more effective with their organisational kind of results. But yeah, Nick, can I bring you in now?
So, I mean, I'm definitely coming to this from a different perspective, but in terms of co-production, we've done a lot of interesting work around job fairs, which is sort of the analogue version of what we're talking about here. And particularly in West Yorkshire, they just couldn't figure out why they got really, really low attendance, like more people on stalls and people turning up for jobs at their job fairs. So basically, when we got the communities to co-produce it, there's some really, really basic but also counterintuitive things. Didn't cost any extra money, were logged on. Like, don't have it in big open spaces. People who are worried about work do not want to go into big empty town halls. Make sure there's some organisations offering direct hire on the day. Find them, because that will drive up rate. Make it really easy for people on the day to share it with people, because that's where you get higher footfall. But the system themselves, find it, working through the lens of academics or professional teams to find those questions, they would never have got there in that time. And basically, when they said, look, we're going to give you a pot of money, the community, you've got these questions, we want you to be the researchers on the project, it just completely, basically went from, less than 10 people turning up to an event to, 250 people in the space of one morning. So yeah, you've got, in terms of user experience, if it's very classic, clear program methodology from our perspective.
Brilliant, thanks, Nick. Yeah, fantastic examples there, and certainly I know from experience of doing those kind of recruitment fairs. We in councils sometimes do fall for some of those traps. Really pleased that CJ was mentioning some of those lessons during the pandemic. I know very much from working with Grace in Hertfordshire how strong the creatives and campaigns were during them. But Grace, you've also been very patient, not quite waiting until since the pandemic to come in with your question, but over to you.
Thank you. I wanted to know what kind of feedback you got from businesses themselves who are involved in the scheme, and what their kind of reaction was to it, and how eager were they to get involved, and what sort of support they needed. And also, if you could give some example of the kind of stakeholder events you went to, that would be really interesting as well.
So I'll be honest on this. So there have always been a couple of audiences that we have worked on in the last couple of years to really get under the skin of, and that's our business sector and also our young people. We now have an organisation called Business Surrey, and they very much connect with businesses. I can't comment on how it was received because I don't know. I haven't been in contact with them, but I'm sure that Business Surrey will have a lot better understanding of how it's been received. And I think whatever learnings they've taken from this, they will then take on to the new initiative, which is Connect to Work, which is coming in June. So I assume that. And with regard to engagement events, the referring agencies had been, so Get Set and Way Through, they had been to some events. I wasn't over all the events that they went to, but we did supply them with engagement materials so that they could hand stuff out. But we have quite a few sort of forums that we attend. So we attend things like the Surrey Charities Forum, which is a group of all the VCSE organisations in Surrey, and we've got Surrey Minority Ethnic Forum. So we've got good contacts with all of those sorts of people, and we're aware of some of those forums and events. And we have our engagement team here at Surrey. We have a weekly check-in on a Wednesday where all the people across the council. It's just a very informal drop-in session, and we share where we're going to be, and so we very much piggyback on anything else that's going on, and oh, that would be good for this audience. So yeah, so we're sort of always talking to each other about what opportunities there might be.
Yeah.
Brilliant,
Thank
thanks, CJ. Any other contributions on that kind of referral question from Grace to you, Matt or Nick? Happy for you to broaden it out if you want to.
I've got another question you might want to come in on, actually, that might be a bit more relevant to you guys, around the sort of tone of the messaging. So obviously with the kind of government announcements around trying to get people to go back to work, I think there's an assumption around, you know, for this idea of forcing people to work, and you're going to be, you know, benefits cut and all that, those sorts of things. How do you manage the tone of the message when you've got the research that says it improves health outcomes for people to be in work, obviously for people that for whom it's appropriate? How do you manage that, given the kind of background of people maybe assuming the opposite, and, you know, things around fairness and stuff like that? How have you kind of managed that?
I think it's hard. It's like going back to the COVID times, and a lot of people thought they were being forced to get vaccinated. I think it's using video content becomes really important, and using content of real people, even really unprofessionally filmed content. So having someone almost talking into their phone about the benefits that they had getting back into work, and the improvements on their mental health, improvements on their physical health, everything that kind of they can attribute to the fact that they've gone back to work, and then getting as many people in the location as possible to see that video will then encourage that person to take that next step. We found that work really well during COVID, and we do try and replicate that in a lot of other campaigns that we run. And if there's people from different communities, using people from those communities in the video, and then targeting websites that they frequent. Again, I'll keep going back to COVID because it was one that we did lots on, but we had a Ghanaian nurse talking about the powers of the vaccine in Ghanaian that was running on Ghana Web to anyone in that location that was accessing it. So it was on a website they held close to their heart, being spoke by someone in their mother tongue, so they're more likely to then engage with the content that's going on. So yeah, use the people from the audience to talk back to the audience would probably be recommendations.
Thanks, Matt. I'm going to bring in CJ and then Nick, but can I also just sneak in a sort of supplementary in terms of how did you potentially kind of deal with members or the politics of some of that kind of thing that Grace has just talked about?
So shall I come in? So just on the the case studies, that was going to be the next part of our campaign, in terms of getting some of those real people and real, you know, how it's benefited them, and you know, real people, real voices, and some of those community champions. So that was going to be the next bit. So it's evidencing, you know, what's happened. And sorry, what was the question around members?
So I think it's just building on what Grace was kind of inferring around that, you know, the sort of, I guess, the political kind of area around this, and whether you had any issues with members, or you had to sort of get buy-in from some of the political stakeholders for this specific campaign.
No, I think everyone was very much behind it, and I think I mean, we have our mantra in Surrey, which is no one left behind. And I think it's absolutely recognised that certain cohorts, and we have 21 key neighbourhoods that we've identified across Surrey, and a lot of our efforts are concentrated on those 21 key neighbourhoods in terms of inequalities. So I think in terms of stakeholder, you know, comms toolkits and spreading the word, I was quite surprised, I'll be honest. I kept seeing it popping up everywhere, and I'm a bit like, oh, okay. So it did resonate with a lot of people, and I think a lot of people wanted to sort of spread the word on it. So I think it, from that point of view, I think people saw the value in it.
Brilliant. Thanks, CJ. Nick?
Yeah, I'm not sure. This isn't from a campaign perspective, but I think a lot of the work in More Indifferent is around ensuring that it's great to have a campaign getting people into the jobs in the first place, but making sure the employers have got preparedness to make accommodations. So they need, if we're talking about people far from the employment market, probably one of the number one reasons for not being in work is that they hated their last job. And to ensure that what they're going into is not going to be Groundhog Day for them. So you've got to make sure that they've got a welcoming experience. The line manager, the middle managers, he's got support to actually provide that space for the person. Because if you can make that first week fantastic for the person, it's going to be a gain probably for the system as a chancellor. So I think it's about how the campaign is working with the reality on the ground and make sure that there's enough resources, because then you can use those success stories to then drive through and myth bust some of those things. But you need these success stories to happen in the first place. So to ensure that you've got enough employers, there are them. Even in Surrey, you've got Active Prospects, which is probably one of the most innovative, forward-thinking social care providers in the country. They make they make entry-level social care jobs. They make a pathway to that into senior management. They're really, really fantastic, but you need to sort of make them become the average rather than the outlier.
Brilliant. Thank you for that. Maria, I'm just going to come in to you in one moment, but I do just want to have a kind of a final shout out for any other comments and questions. Appreciate that some people may need to duck out shortly. Also want to just note Fiona's point around that kind of localizing the message in Dorset, and that's definitely what we've heard there. But Maria, do you want to come in?
Yes, I just wanted to kind of, I think, speak a little bit to Nicholas's point, which I thought was a really good one. I think you said it earlier as well about making sure that all of the touch points are sort of ready and available, so that you've got the comms campaign, like you say, that's great, the awareness, but then when it goes to the application form, or when it goes to the intervention or the first touch point with the employer, the whole system has to work. So I just wondered if there's any kind of thing from a comms and marketing perspective that can be done in terms of that early engagement, perhaps with employers, sort of making sure that they're sort of ready and prepared before the campaign goes out. Are there kind of any sort of routes into sort of speaking to employers that you would suggest, and just to make sure that whole approach is in place before we go out with a lovely campaign, which is then targeting all those audiences?
So I think our experience has been there's sort of a thing which people have got in their heads for some reason, that it's going to be really difficult to engage the cohorts, and the employers will fall into place because we've got job shortages. And the reality is, even with the NHS, which is chronically understaffed at the moment, it's actually really, really difficult. So I think there's no easy solutions for this, but I mean the main thing is start really early. Perhaps don't depend on things which you would potentially think have been the useful things, like the Chamber of Commerce have got variable experience across our network. And I think just start looking at the big anchor organisations. So in Surrey, we've got the Animal, something which I hadn't heard of before, by the way, the Animal Plant and Health Agency, which does all the testing to make sure that plants coming over here doesn't create more viruses. But they've got their headquarters base in Surrey, and their civil service. You would have thought they've been really, really difficult, but they've been fantastic. They've been really, really pushing the flexibility around this. So I think start off with your top 50 employees in terms of headcount. Don't have any preconceptions about how good they would be based upon their NHS industry. And what you've got to sort of get through, I think the real key issue, our learning point, is you can have great conversations with the chief executives, but everything gets gummed up with the HR team because they've got their processes and they've got to follow those processes. So I think you need to have both sets of conversations going. It sounds like a lot of work, but if you've just got 3 to 5 of those organisations working, and you've got success stories from that, that's far better than trying to, work with 100 to do something quite mediocre.
Brilliant. Thanks,
Thank you.
Nick.
Thank you.
CJ, did you want to come into that point, or just a slightly different part?
Yeah, I was just going to say, in terms of how we work as a comms team and how we've got our different directorates, we've got adult social care, we've got children's, we've got economy and development. And I think this had sat in the adult social care directorate, and I'm always about unified ways of working and trying to join up. And I think that a lot of this work is now going to sit in the economy and development team. And I think that would probably drive some of those business connections. There'll be a lot closer working with that cohort. So I think it's about better joined up working within the organisation as well, in terms of reaching out to some of those stakeholders.
Thanks, CJ.
Brilliant. Thank you so much. I can't see any further questions or comments, but just want to reiterate some of the messages that I've been receiving on the comment chat. It's been really fantastic and insightful session today. I'm going to close it early because I think that's always a useful thing. Give you a few more minutes back in the diary. It's been a great first session of this series. Please do share some of the lessons within your organisations. We will share the slides and also the recording from today afterwards, but also just to give you a heads up that we've got our next session is going to be on children's services. We've got an unawards winner or shortlisted award coming up, and then we're also covering transport and public health. But we're always up for hearing what other topics you'd like to hear about, and potentially if there's enough interest in this subject matter, which sounds like, we can do some form of follow-up there. But thank you once again. Thank you to CJ, Matt and Nick for your insights, and thank you to everyone for joining today. Take care, everyone.
Take care,
Bye.
guys.